My name is Lovett Smith-Bobber. I am a manager at Health Africa. Thank you for taking the time to join us for the 11th episode of our Insights webinar series. Insights is a public health webinar series hosted by Health Africa with the main purpose of fostering conversations with professionals within the public health space. The topic for today's episode is Time to Deliver Zero Malaria, investing in sustainable digital health innovations. As we all know, malaria is a life-threatening disease that affects millions of people worldwide, particularly in sub-Saharan Africa, where the majority of cases and deaths occur. Despite significant progress in the fight against malaria, the COVID-19 pandemic has set back efforts to eliminate the disease. However, with the right investment and sustainable digital health innovations, it is very possible to achieve zero malaria by 2030, as envisioned by the Global Technical Strategy for Malaria. To discuss the potential of digital health innovations in accelerating progress towards zero malaria, this webinar has an expert in the field of public health, technology, and innovation. Through this discussion, today's participants will learn about the latest advances in digital health tools and strategies for malaria control and elimination. The webinar today will explore the importance of sustainable investments in these innovations, as well as the potential challenges and opportunities in implementing them at scale and scale it up in malaria endemic countries. Ultimately, in today's webinar, we'll be able to raise awareness and build consensus around the urgent need for sustained investment in digital health solutions for malaria and to ensure that we can deliver zero malaria in the near future. We have a guest today to discuss this topic. I am really excited by the words of knowledge we have in the virtual room today, and I do hope that you can glean some useful insights from his experiences. Before I proceed, I would like every one of us to drop our questions in the question and answer box and not to use the chat box. Thank you so much. Our panelists today named Dr. Dennis H. Mark. Dr. Dennis has worked as a clinician in public and faith-based hospitals as district medical officer, program manager, child health EPI. He's currently the program manager, Health System Strengthening, Ministry of Health and Sanitation, while doubling as the acting program manager, National Malaria Control Program in Sierra Leone. That's amazing. He's a foundation member of the Sierra Leone College of Physicians and Surgeons. All right. Dr. Mark, you want to welcome the audience? You want to say one or two things before we go into the questions?
Yes, thank you very much for that introduction. It is my pleasure to join this webinar, and I want to thank eHealth for organizing it and also to welcome all participants. Thank you very much.
Thank you, Dr. Dennis. To start with, let's talk about digital technology. How can we effectively integrate digital technology into the existing malaria interventions to optimize efficiency and effectiveness? What do you have to say about this? Yeah.
Okay, I'll start with the Sierra Leone scenario, how we have used and how we continue using digital technology to improve our service delivery. One key area that's really making a huge difference, the area of supply as an inventory tool for our commodities and also for distribution. As I talk to you, this tool was piloted in a couple of districts and is now rolled out. And it's really working great for us as a digital tool for our commodity distribution yes, and quantification as well. There's one that is pretty simple, we may think, but it's working for us very well. And that's the mobile-based innovations through SMS messages to the general population. We engage them and they send messages saying, if you have fever, for instance, if you have body aches, if you have feel symptoms of malaria, just go to the nearest health facility that is close by, because the commodities are available there. The policy in Sierra Leone is to test before you treat. So if you go with these symptoms, a health facility will test you, and if you are positive, they can then go ahead and treat. It sounds very simple, but it's working very well. It reaches a huge proportion of the population in Sierra Leone, since mobile cell penetration is now very good. I think it's in the 70, 80%. In the 2017 mass campaign, we used Rapid Pro mobile app in that campaign to track the supply at that time to our PHUs, our peripheral health unit. And we found Rapid Pro, that technology also very helpful at that time. Or another form of technology which is in use is the ComCare. ComCare, you see, currently PMI, the US President's malaria initiative, is helping us to do, supporting us to do indoor residual spraying in 2 districts. That is the Bo district and the Bombali district. We have done it for 2021, we've done it for 2022, and now 2023. And we are using ComCare as an application to track the activity in those 2 districts. And SMOT, it's another technology, that's the solar-powered mosquito trap. The China CDC and the US CDC is helping us do entomological, that's the vector surveillance. And it's a wonder to use this SMOT, we call them SMOT, solar-powered mosquito trap. So we engage communities, and then they allow us to go set these traps in their homes. And then these traps catch the mosquitoes, we take them to the lab for analysis. It's working very hard for us. Of course, the powerhouse of the Ministry of Health and Sanitation in Sierra Leone is the Directorate of Information Planning. And the system that is in use nationwide for catches all our data as a ministry is the District Health Information System 2, DHIS2. That's also another mobile innovation that is in use in Sierra Leone. In addition to that, at community level, we are using EIDSR for surveillance and response. And this tool is used to track disease surveillance, raise alert at all levels, and they report on a weekly basis. This tool is very helpful because we have trained our staff, and there is weekly reporting, not only for malaria, for EPI, for child health, all other activities. So we do have this EIDSR tool that is in place. What I'll consider also as technology is the malaria diagnostic RDTs. And before now, we used to use microscopy, but even at community level, I think this is a novel, the use of the RDTs. They may have their downside, but I consider that a novel innovation that's really helping our program. So for Sierra Leone experience, Sierra Leone scenario, those are the different activities, technology, and innovations that we are utilizing in Sierra Leone.
Thank you, Doctor, for that robust feedback. Your feedback, it shows that we have a couple of digital tools out there used for malaria interventions. And there was one striking information you shared. You said some of these tools, there was one you mentioned particularly, that it's quite simple. The way it's designed is quite simple, but it's giving us massive results. So what we know from there is a digital technology for malaria intervention doesn't have to be complex. It doesn't have to be something so big, just some simple digital technology can actually create a massive impact. That's a good one to note. I would ask, what are the major challenges faced in implementing digital health interventions in the agriculture? And how do you think we can have all of these overcome?
we have these different tools. I think our key challenge really is to make them interoperable with our DHIS. That is the power base of the Ministry of Health and Sanitation.
Okay.
We are making them interoperable with the DHIS. For instance, the M supply that is going on and LMIS, the logistics management, we really need to get it right so that that information goes into our database, which is the DHIS tool. That's really the key. It's a challenge, but we are working on and we are requesting partners to help us so that this tool works with that. They speak to each other, they talk to each other. And, that's basically what I think the key challenge is. Of course, internet connectivity, especially in the hard to reach communities, is also a challenge, internet connectivity. And you can have this technology sitting out there, but if the cell phone penetration is especially hard to reach and hardest to reach, and the marginalized population is not covered, that's a huge challenge to look at.
Okay, so if the challenge of interoperability is solved, there will be so much that digital health innovations, we bring into the malaria intervention or malaria control. That's good to note. That's what we should take note of. And then, what do you think about having a public-private partnership? What's the prospect of this? Collaborating with public and private partnership coming together, to ensure sustainable investment in digital health innovations for malaria control. How do you think that is? How is that even working currently?
We have some form of PPP, public-private partnership, but that collaboration needs to be strengthened. As I talk to you, the Global Fund is here. We are working on GC7 development. That's the NFM4 development. And we have pharmacists here. What we've been doing as a program is encouraging private hospitals, private practices to come join us in the fight against malaria. We have an MOU. You can come over to the program and then we do an MOU with you. And then we give you our supplies, free RDTs, free commodities, but the challenge has been getting the returns from them and going strictly by a policy of test before treating. But so that thing came up, we are still working on it. We even gave RDTs to, let me bring this up again, to pharmacies. Okay, and now we gave them free RDTs. Initially it worked well, but in Sierra Leone, people can walk to the pharmacy and buy malaria commodity just off the shelf without prescription. And so they said, you know what? Yes, we are happy you've given us free test kits, free treatment. But some people go there and in haste, they don't want to wait for the testing before treating. For some people, for some pharmacies, what they do, yes, they will use our test kits to do the test, and then they can also, the patient can buy off their shelf. I say, well, that is a way of supporting your business. So in your case, what you need are only the test kits, not really the free treatment. Business people. And then this issue came, okay, but we are spending time, we are using our personnel to do this free test. Can you guys help support some incentive? So that's where we are. That's really what, so this collaboration really needs to be strengthened. We need to bring them on board. Of course, we're doing that with the support of the Pharmacy Board of Sierra Leone, that they are regulatory body, and but it's a huge challenge there. So what I'll say for this is that the PPP needs to be strengthened. Faith-based organizations here and there. In fact, I just had a meeting with PMI. I think the challenge is really also they don't have like dedicated M&Es to catch these information for onward transmission to us. So we are thinking, okay, what if we brought these M&Es from these faith-based hospitals and clinics and from these private practices, train them and tell them the importance of the data. So those are really challenges we need to look at. that we are grappling with. Yeah.
Wow, okay. So there's so much that public-private partnership will do to foster sustainable investments in digital health. That's good. Okay, so please, before I proceed, this is to the audience. If you have questions, don't forget to drop your questions in the question and answer box, and we'll do well to ask your questions, to read out your questions for our panelists to respond to it. Dr. Dennis, again, I would ask you, how can we improve access to medical information and data? How can we enhance communication and promote online education and health apps in malaria control?
Come again. Go a
Okay,
little
so
slow.
how do we use digital health innovations to improve access to medical information and data?
Okay, so yes, like I share with you, a greater population is really an engagement with the private service providers, the mobile phone service providers. If we really want to reach a large proportion of the population in Sierra Leone, we craft these messages to them and then send them out to the general population. The challenge with that will be, what if they wanted to revert to us with questions? We don't have that. We have not addressed that yet. Yes, the information can go out, but what if they wanted to revert with questions, with clarifications? So that's a gap. That's a huge gap in that area of technology.
Okay. So focus needs to be placed on using digital health innovations to really improve access to medical information. FSC, by the PPP you made mention of, can also come into play here, where we have our digital health tools promoting communication and then promote online education and health apps in malaria control. That seems useful. That's good. Do we have any questions from the audience yet? Okay, no questions yet. So, Dr. Dennis, as one of the last questions that we're going to have, what final word do you have to say around digital health innovation or digital health tools? How can we use it? How can we ensure that we use digital tools to achieve zero malaria? Let's say we'll talk about 2030. What's your own thoughts around achieving this by 2020 with the rate at which we're going, or with the rate at which we're utilizing digital health tools to control malaria? What's your take on the achievement by 2020? By 2030, please.
Yeah, you see, that's why I like the theme for this year's Zero Malaria, Invest, Innovate, and Implement. That's really a call to action by digital technology partners, including eHealth that's organizing this. What I think is we really need to do is a challenge also, which I have not mentioned before. We need to do a partner mapping. You see, we have eHealth, we have Macro AI, that's another. They are using AI as a matter of fact, to, especially with our HRH mapping, where our staff, their qualifications, their KDR, their responsibilities are at any point in time. What we probably need to do is to do a mapping of digital health partners to know who is doing what, where, and then bring them together to make sure we coordinate what they are doing, and then we put thoughts together to make it one big. But technology is the way to go these days, and I have a staff who lost her phone, and she said, you know what, I just can't function without my phone. For me, what happened to me, I forgot some meeting I went to, I left my charger, and then my battery ran out, and I was in a meeting, I just felt. So can you imagine if somebody lost his cell phone or his laptop? I mean, you're like, what can I do without technology? So I really believe technology is the way to go, and we just need to consolidate, collaborate, and map out who is doing what. There are more coming in. I've heard of Chisu. Chisu is coming on board, I think, next year through PMI. And I think for now, that's what I think.
Okay, thank you, Doctor. There are some questions here in the QA. Let me just read about two of it, and then we should be wrapping up. Sugesto is asking that, do you think communication can play a role in improving the existing public-private partnership gap? If it's a yes, how do we do it? I think you responded to this, but you might want to talk about it again. There's another question that is similar to that, saying your experience of rolling out digital tools. Do you encounter issues with technology adoption, and how are you able to overcome such? So are there issues with the adoption of tools that are being introduced? If there are concerns around that, if there are issues or if you've encountered any issues based on your experience, can you tell us how such issues were overcome?
Okay, thank you. I'll start with the first question. Communication can play a role. Of course, communication will play a huge role. But you see, when you want to interface with the private practitioners and you meet them at a time when they are extremely busy, or you want to call them together, they send people who are not really like the quote unquote decision makers. And you go to engage them and they are very busy. Communication will be key. The short answer to your question, yes. I think we just need to devise ways on how to reach them, when best to reach them. And yeah, basically that. Because they are busy, they are engaged in for-profit business, and in order to get their attention, their time. Yes, there are a few who are committed to what we are doing, but the rest of them, you know what, I don't have much time for this. Can we make it fast? And when you want to make it fast, you don't get it as right as you really had intended. Can we work towards designing an app that can speak to malaria control? Are we talking specifically for malaria control? That's my question before. Yes, specifically for malaria. This could be it, but will it not be introducing a lot of tools if we have one app for EPI, another app for malaria, an app for HIV and TB, another app?
A lot.
Yes, it will. That will be a lot, and getting people to switch from malaria app to HIV app to TB app to immunization app. That is, but yes, this is something that could be considered, but that's the challenge with that app, in my opinion. Chatbox AI, yes. How we can go about it, I think the experts, the IT experts, we have to go with this. We need a chat box. Like I mentioned in one of my challenges, that's really a huge challenge for us. So if that is something doable that eHealth can lead on, we are open to really engaging and utilizing that support. In your experience of rolling out digital tools, do you encounter issues with technology adoption? And how are we able to overcome this? Yes, the theory of innovations, you know, the early adopters, and then there is that wait and see category of people. But for this young generation that I see right now, they adopt technology just like that. It's the folks my age that will take time to, you know what, let me wait and see how this is going to turn out before I go. So for me, I would say yes. For the younger generation, there shouldn't be issues. Probably, in fact, I always tell my friends, these kids at home spoil me to operate my TV, to operate these gadgets at home. They just take it and do it for me. But yes, I think so. And how can you overcome such challenges? For the older generation, the middle-aged generations, we just need to reach out to them and say, you know what, if you are challenged with this, engage your kids at home or your university students. They can take you through. That's what I think.
Okay, thank you, Dr. Dennis. It has been an awesome session learning how digital tools or digital technology can promote the achievements of zero malaria. Thank you so much for your session. On behalf of Earth Africa, I want to appreciate every one of us for taking the time to join or to attend this webinar. Before you log off, I want us to take the time to fill out the survey that shows up when you end the webinar. We would love to get your feedback. Thank you so much for being part of today's webinar. And to Dr. Dennis, thank you for joining us. We appreciate the robust information we got from you. Thank you, everyone, and see you next month.
Thank you. And thank you very much. And thank you to eHealth for supporting the World Malaria Day yesterday. They were out there with us and, they support us. Good. Yes. Thank you so much, eHealth Africa and eHealth Sierra Leone. We appreciate your partnership. It was very good. Yeah, thanks.
Thank you so much. All right, bye, everyone.